Hello, everybody, and welcome to the inaugural post of Cannabis Talk Time with your hosts, Tashi and
Wash.
presented to you by PersephoneMagazine.com. Just as the legal disclaimer that we have here in front, any reference to cannabis use in such a sense is strictly in a medicinal sense, first of all. Second, it is only a hypothetical until such time as the recognized state legalizes it as such.
Yes. So,
Everything's just hypothetical here.
hypothetically.
Hypothetical. Totally. So, as far as the main difference goes between medicinal and recreational use, how would you define that, Wash?
Well, medicinal use is where some of the benefits of marijuana can help to alleviate some of the side effects or symptoms of whichever disease or treatment you're going through. For example, with chemo and cancer for me, marijuana can help alleviate chemo pain and nausea and some of the appetite reduction effects that my chemo puts me through. And sometimes some of the spaciness that my brain damage causes me as well. Um, as for recreational use, this is strictly, there's nothing wrong with you, you just want to kick back after a long, hard day. And so that's, in my mind, where the difference is.
Okay. I can pretty much agree and follow on those lines. It's one of those medicinal use, I see it as either a tightly regimented dose control per patient or else something that is defined to usually one specific strain of cannabis to treat a specific problem such as nausea or
versus a painkiller.
Yeah, such as nausea or pain relief or muscle relaxant or treatments for insomnia, sometimes due to pain issues, things like that. Whereas recreational use, though it may have some of the exact same benefits, is usually done in a higher amount to achieve a, for lack of a better term, higher state than one has with medicinal use.
Yes. The attempt is not at achieving functionality, but at just relaxing oneself from stress.
It's the same thing with, any controlled substance, as it were, alcohol, cigarettes, controlled painkillers, that sort of a thing. It can be abused. It can be used to alter your sense of consciousness, or it can be used as in at least, medicinal painkiller type. If used properly, it can do its job.
Yes, and with a lot lower risk of addiction than a lot of normal prescription meds.
So, we do have a couple of intro questions here, and we are always willing to take more questions. Feel free to send them in anytime. First one we've got here. What is your preferred smoking method?
Preferred smoking method?
Yes.
So the vape doesn't count?
Yes, it does.
Oh, vape by far.
Okay. What is a vape for people who
Okay.
And keep in mind, short.
Short. Okay, a vaporizer contains a heating element that heats up a small amount of powdered, crushed up marijuana. So this releases the vapor, and then you breathe in these vapors. This is instead of getting all the smoke and ash that you would get from burning it. Now, Long will clean out some of that, but a vaporizer leaves behind... Water pipe. A vaporizer leaves behind a very, very nicely dried powder. And this can actually be used again in baking products, which we'll get into later. Which I find advantageous a lot of the time.
I agree that the vaporizer is quite nice and a lot smoother. It's a lot smoother than, say, the traditional use of joints or perhaps a pipe or water pipe in that case. However, I've grown to appreciate the subtleties of being able to cook with it, and that's pretty cool, actually. That leads us into the second thing is, you can cook with it, and more than just, the special brownie sort of a thing. Yeah, it's not really limited to just dessert foods, though.
No, it's really not.
Though those are good because they do contain extra calories, which in people's case, for like AIDS patients and cancer patients who need to keep calories high and stuff, it can be definitely good. However, it can be used in many different foods. Since cannabis itself is lipid soluble, as long as it's being combined with the right amount of heat and the right amount of lipids, such as milk, butter, or a different type of oil, it can still be infused and have that same THC
It's
conversion.
real big on the oils and fats.
So pretty much anything that involves an oil or a fat or milk in its preparation or cooking, you can convert to adding cannabis into it for medicinal purposes.
So a milked tea might work as opposed to just a straight tea.
Yeah, milk tea, milkshake, fruit shake.
Yes.
You can combine it with several different meats, sometimes with vegetables. And since there are different strains, it's not really limited to one certain type of taste, as some people might think. In fact, if you prepare it right, sometimes it's rather tasteless. Which leads us into a very specific question for you.
For me?
Yes. Now, in regards to your cancer wash, what do you feel is the biggest benefit that you get from smoking cannabis? In regards to possibly, is it that it reduces your nausea? Does it make you hungry? Both? Something else? A combination?
I definitely say that I put on weight or maintain weight easier with marijuana than without. And in fact, I was kind of anti-pot before. Circumstances have made me to see otherwise. And I'm actually more for the use of this than anything else. But it helps me just keep, amongst other things, keep food down, keep the pain away. And then appetite stimulants. I'm not sure whether it's the pot or the chemo. Probably the pot. But that just makes me eat so much food, which helps.
I don't think the chemo makes you extra hungry, honey.
Maybe not.
No.
I said probably not.
Yeah,
okay. But those help me eating rapaciously all the way through my chemo week.
Okay. Next question comes in from another viewer, and this is from a non-smoker.
Non-smoker.
Yes.
Okay.
Is it as awesome as I have always dreamt? Yes and no. For medicinal use, it's rather wonderful in that it doesn't really do one specific thing. It usually helps with sometimes a variety of different things. You know, menstrual cramps and headaches. It can also help with constipation sometimes, with nausea, with increase in your appetite, with eye problems and different anxiety disorders. So there's a variety of different uses for it, and if controlled in a medicinal amount, you can still be rather functional and have that same relief.
I think.
Now, in a recreational use, which is
this one I believe is a little bit more about the recreational
which is where
use.
I think the person was going here. In recreational use, yes, it can be. Imagine if you actually try to or can, the fact that you can sort of project your imagination on top of the world as it exists, so you see things a little bit differently, in addition to being able to go into your own mind. If you close your eyes while you're high and have some music on, sometimes it can lead to all sorts of different adventures within yourself and your own imagination that you've never really experienced.
And
it helps.
It's also really quite safe as opposed to other drugs, which leave you more motive. The nice thing is that it's really hard to get into a lot of trouble when you're glued to the couch.
Yeah, or when you have a big enough hit and then you're essentially, instead of getting alcohol poisoning and dying, if you get really, really, really stoned, you tend to just fall asleep.
Yeah, it's pretty much straight in.
And
so
not many people wake up with headaches afterwards.
No.
I would definitely advise, though, for first-time smokers, if you can avoid joints, if you are a traditional smoker and have smoked cigarettes for a while, joints would probably be okay. It wouldn't be that hard of a transition for you.
Her experience, not mine. Mine.
However, I would suggest starting, if you can at all, with either a water pipe or a vaporizer, as it is a little bit easier on the lungs. Make sure that you have somebody around who you really trust, who can stay sober with you for that first time and watch you. Because you really do not want to be going and walking out to the store at 11 o'clock at night and spending $20 on Doritos when you still have food at home. And sometimes if you're unsupervised, that can happen.
Can I also insert a point? Now, when we say easier...
As long as you do it really fast.
It does not necessarily mean you will not cough. You will cough a lot.
That's the point, though. That's how you get it.
Yeah. But that's...
Sweetie? So that about wraps it up. If you have any questions, leave them in our comment section below, or you can email us at verdalliance@persephonemagazine.com. We'll see you next time.